Okay, so let's take a minute and talk about what hormones we want to test when we're thinking about hormone balancing for women over 40. So, whether we're perimenopausal and cycling or postmenopausal, our periods have stopped, we're looking at testing the same hormones. Of course, we can look at thyroid, and that's a blood test. So, you can do that with your primary care doctor or on your own at a direct consumer lab. But when we're thinking about sex hormone balancing, it goes well beyond estrogen. We've talked about how we do this. We're talking about our saliva testing, not what we would get with our primary care doctor, not our blood work, but our saliva hormone testing, where we're looking at tissue levels or what's available for tissue use for our body. Remember, it's what's in our tissues or not in our tissues that causes symptoms. So, when we're thinking about that, we're thinking well beyond estrogen. Of course, we can look at estrogen there. So, our saliva testing can check all of our sex hormones. With estrogen, there's actually three main estrogens in the female body, and we can look at all of them. So, there's estrone, estradiol, and estriol. When we say estrogen, we're usually referring to estradiol, so we at least want to check that. But sometimes it's important to see the balance between the three. So we can look at all three estrogens, we can look at progesterone, we can look at testosterone, we can look at DHEA, which is a hormone from our adrenal glands that serves as a building block for our hormones, and it's important for our memory, it's important for our muscles, for our joints, all sorts of stuff. And we can look at cortisol. This is the oftentimes overlooked, forgotten hormone when it comes to hormone balancing. So, when our cortisol levels are off, we can feel more stress, we can feel more fatigue, we can have difficulty concentrating, trouble with sleep, problems losing weight, all sorts of stuff. This is not something that's checked in our conventional medicine, typical approaches to patients. So, this is a really, really valuable tool to look at in salivary testing. And if you've worked on everything else, you've worked on your estrogen, your testosterone, your progesterone, your thyroid, we've seen all of that. Probably what's still missing, if you still have symptoms, is looking at your cortisol levels. And we can see all of that in saliva.